The BVI Health Services Authority continues to depend on government subvention to subsidize its operational cost due to the board's revenue shortfalls over the years. To address this problem, government plans to amend the policy that governs who will be exempted from paying for health care. Governor Boyd McCleary, in a speech from the throne, said government will amend the current hospital policy that permits 10 categories of residents to be exempted from paying fees for healthcare service in order to address the revenue shortfall.
Madam Speaker, just over 8 months ago in my address to this Honourable House, I made mention of various challenges affecting the BVI Health Services Authority and pledged to introduce measures to improve its operations. Included among these challenges has been the significant revenue shortfalls experienced by the authority over the years, even as healthcare costs have increased exponentially. To help address this situation, Madam Speaker, during this session, my government will bring before you legislation to amend the hospital regulations, which currently provide for the following 10 categories of residents to be exempted from payment of hospital charges: persons 65 years or older, school children, the mentally ill, the indigent, police officers, prison officers, prisoners, health workers, workers in the Dean Donovan Home for the Elderly, and firemen. Since the enactment of those regulations in September 1927, the population dynamics in the Territory have changed considerably. Added to that, a large number of persons under the exempt categories are now covered by health insurance, with insurance premiums being paid on their behalf by the government.
The board's chairman, John Klein, during a community meeting in Virgin Gorda, explained that the BVI has one of the lowest healthcare rates in the world. He said the board is operating at a loss and depends on government's $27 million every year for its operation. But plans are underway to review the fee structure to increase income and improve service.
If it had not been for the $27 million of government subvention every year subsidizing healthcare in the BVI, we won't have a healthcare system, because we bill about $20 million there. Out of that, we collect between 2 to 3 million. Okay? There is no way any business model anywhere in the world can deliver $20 million of services and supply, collect $3 million, and survive. Furthermore, most of the people that we see are legally by government exempt. The insurance that the government workers have, the insurance company don't even want to pay because a law said they're exempt. Those are things we have to fix if we're going to have proper health care.
But one Virgin Gorda resident is worried. He maintained that it is a struggle for persons who are earning minimum wage to pay for medical services and medication without health insurance.
If we are to look at it, right, in a very meaningful way, we will find that people are struggling, those who don't have insurance, to look at their prescriptions.
While government is taking measures to bring the health financing arrangements in line with current realities, the governor said they are ensuring that appropriate safety nets are provided to meet the basic needs of the most vulnerable members of the community, and this includes the establishment of the National Health Insurance System.
I'm pleased to report that the consultants have now prepared an amendment to the Social Security Ordinance to establish the National Health Insurance System and the National Health Insurance Division, respectively, both of which would fall under the purview of the Social Security Board. This amendment, along with the NHI regulations that outline the rules and procedures governing the operation of the system, will shortly be brought before this Honourable House. Through the introduction of this bill, all eligible persons will finally have equal access to quality health care at an affordable cost.
Governor McCleary said the health sector remains largely unregulated. During this session of the House, a hospital and healthcare facilities licensing bill will be introduced to provide a legal framework to establish and maintain appropriate and consistent standards for healthcare facilities and professional practice throughout the Virgin Islands.